We're here with Fred Raab, who is a systems engineer at the University of California, San Diego Medical School. And Fred's doing a lot of great work in connected health and really pushing the envelope on smarter health applications. So Fred, I'd like to start, if you can just tell us a little bit more about what you're doing with connected health at UCSD.
Okay. Well, I'm working with a group of doctors in preventive medicine, and so we're basically trying to help people live healthier. And we focus on issues of obesity, nutrition, physical activity, pretty much as it relates to diabetes and cancer. And so we are interested in observing people's behavior, but also changing it and intervening based on their behavior.
And how does the mobile fit into all this?
Well, the mobile is because the mobile is the device that they always carry with them. So we have numerous different programs. Some just use text messaging that send messages during various times of the day and ask them to reply. And based on what their responses are, we can send a more intelligent message. This has been used in things like nutritional programs, medication compliance. We've got a project now with the emergency room, making sure that after you are admitted to emergency room that you'll follow up with the doctor's visits and medications and things like that.
Very important.
Okay. So the other thing we do is we're interested in finding out where people are physically active. So we'll give them devices such as pedometers, accelerometers, heart rate monitors, and all those from those devices we can find out how active they are at particular times of day, and then using GPS we can triangulate and find out where they've been active and what the land use in that environment that they're active in.
And all those devices are connected to the network?
Some of them are. I mean, a number of the devices we use are just store locally and then upload later. Others actually are connected by means of Bluetooth to the cell phone. The cell phone's processing the data and then uploading it to the network.
And clearly you're in an environment where medical research is tops. I know you're also aware of a lot of commercial implementations for connected health. And I'm wondering if you can give us some examples of some of the companies that are doing sort of gee-whiz things in this area that haven't quite hit the news yet.
Yeah, there's a lot of activity going on and some stuff that's just beginning to go through clinical trials. One of the issues with getting these devices onto the market is first you need to get FDA approval because it's a medical device, and that can take several years and several $1 million. And then after you get the FDA approval, you have to go through and get the insurance reimbursement codes. And so that's where things are right now. Probably the only great success story out there is CardioNet, which is doing cardiac monitoring, and that's a system that will actually call your doctor when something is wrong. There are other people working on sort of smart patches that, Triage Wireless. They basically have a cuffless blood pressure monitor. Okay, because most blood pressure monitors has a cuff
squeezes
that needs to
you.
Inflate.
Right.
You can't do continuous monitoring with that, and so their version is cuffless. And again, it sort of relies on connecting to an intermediary device, which then transmits to the network.
And I know you mentioned a company that has a shirt with a lot of sensors.
Yeah.
What's happening
it's the
with that?
shirt. I can't remember the company's
Vitality,
right.
Maybe?
Yeah, it's not Vitality, it's close.
Okay.
But sorry.
So tell me about the shirt, the connected shirt. Are we all going to be wearing a connected shirt?
Well, what we're working with is actually a company in New Zealand called Zephyr. And they have actually, I believe, either been bought or have a substantial investment by Motorola now. And that is actually a band that you wear across your chest. And so it does all the functions that the shirt does, which is basically it provides your heart rate, an ECG, respiration, and body temperature, posture, how straight you're sitting, and also physical activity. And so that's a device that we're working with.
Great. And who would wear the Zephyr?
Right now, it's principally being used as a research tool. It's also being used in coaching and sports. Because they transmit wirelessly, all on different frequencies, so you could basically have every member of your team wear these and see who's exerting themselves and who's not, and the like. The military's been using them for, obviously keeping track of the stress that soldiers are under. You can imagine police, fire. So.
Great. So maybe college football teams will be putting this on, as well as people who might need just reminders about physical activity or better monitoring for their physical activity.
Yes.
And final question, what do you think will be the breakthrough in the home for connected health in the home? Any examples there?
Well, there is several examples already. There's a company called MedApps, and what they make is number of products already on the market, like bathroom scales, blood pressure monitors, glucose monitors. They already store information, the measurements that they've taken, and they have the serial port or a USB port that can upload that data. And so what we're seeing is what MedApps does is they have a device that all these devices plug into, and then it uses the cellular network to upload that to their servers, which can be sent to your doctor, for example. Also, if the device is Bluetooth enabled, they will their device will talk to the medical device.
So an easy way to collect all that data about your health.
Right. But one of the problems right now is that we don't have a really good power efficient radio protocol for these devices yet. And people have been using Bluetooth to date, but it's very, it consumes a lot of power and is very cumbersome as a protocol, especially when you're transmitting relatively small amounts of data. So we're looking at other protocols like ANT, like Zigbee. There's a thing called low-powered Bluetooth. There's a Bluetooth designed specifically for medical devices. And so when those things come on the market, we'll see wireless being incorporated in more and more devices.
Great. Well, thank you very much. Okay. We'll be looking forward to those next developments.
Okay.
Thanks, Fred.
Thanks. All right.